actually care for the numbers of children who need inpatient care. And that not only goes for the children, it goes for the adults. Charity Hospital housed the psychiatric patients, even though it was under the control of the Department of Mental Health. They were actually housed in this complex in Charity Hospital, which had over 100 beds. And to this day, not one bed has been replaced that was lost at Charity. There's a stopgap type of, it's a stopgap measure that was put into place at the New Orleans Adolescent Hospital, where now they have taken some of the adolescent beds and allocated them to adults. And it does not at all take care of the problem. But it's further traumatizing our community, because if you have psychiatric problems, you are now taken out of the community, away from your support systems. So you may have to go miles across the lake or miles to northern Louisiana for psychiatric health care.
Thank you. Do the judges have any questions?
Can I add something?
Oh, yes, please.
Okay. I would like to add that with Katrina, the city has lost many of our African American healthcare providers. These providers, many of them want to come back, but they can't come back because it just would not be financially feasible. Many of the doctors who admitted patients at Methodist Hospital. Methodist Hospital is now closed. Therefore, it would be very difficult for them to get admitting privileges at hospitals like Touro and Tulane. Because Touro and Tulane and Ochsner are having their own staffing problems, so they're not going to include new people, new docs to come in and admit patients. They're barely keeping up with the admissions that their pre-Katrina doctors are bringing in. So that presents a problem. Also, we have already heard testimony about the cultural and linguistic competence of some of the doctors, and I feel that many of the African American doctors related much better to their patients, and that presents a problem in itself. And in closing, I just want to say that healthcare delayed is healthcare denied, and right now many people are being denied healthcare.
Thank you.
I have a couple of questions, ma'am. You told us that the suicide rates have increased. Do you have any statistics on that?
I can't give you hard numbers because I did not bring that with me, but post-Katrina, I can tell you in the adjacent parish, which is St. Bernard, almost every day there was a suicide or a suicide attempt. We know that there has been a dramatic increase in suicide. The Children's Health Fund has done studies with mental health issues, and they did talk about the number of increased suicides and suicide attempts.
Would that be amongst adults or children, or both?
I believe it was adults.
Okay, thank you. And my other question was, you told us about a young man named Terry Burton, who you said, I believe, was mentally ill, and he stopped taking his medication and he was killed. Do you know any more details about that?
Only the accounts that were given to us was that Terry apparently was brandishing, from what we were told by the National Guard, that he was brandishing a BB gun, and that they felt their lives were threatened and they shot him.
So by the National Guard?
It was by the National Guard.
Do you know when that took place?
It was some months ago. I can't remember exactly, but it was post-Katrina.
Okay.
Okay, and just to respond to one of your questions, in the packet that was given to the judges, it's organized by year, and under 2006, there's a report from Columbia University's Mailman School of Public Health, and there's some information in that report about suicides, and
Is
also...
that report part of this package?
Yes.
Okay.
And then also in 2007, which is, if you just flip the page, there's an article from August 15th, and it describes one particular suicide and talks some more about suicides. And that's in the packet as well.
Okay.
And that's from a New Orleans newspaper.
Actually, while we're at that, Counsel, you gave us a few different documents. Do you want these all to be exhibits? And if so, please tell us what is what.
Sure. The largest packet, we just assembled it in that way. I think that there have been some things translated by the Tribunal as well. I'm not sure if you have those yet. But in the large packet, there are about 2 reports and several articles touching on various issues regarding healthcare in New Orleans.
I'm holding up one large packet. Do you want this to be Exhibit 1?
Yes.
Okay.
And I think the other thing that was given to you, I think there were only 2 things given. Am I correct?
Yes. But we have another document, seems to be 3 or 4 pages. It starts off written testimony of K.
Yes.
Brad.
Yeah, I was going to introduce that when that witness spoke.
All right.
And those are the 2 things that you have, right?
That's all we have, yes.
Okay, thanks.
Thank you.
Can I add?
Any other questions?
Yeah.
Yes, Ms. Ayatoro?
On Mr. Burton's, I hate to push you on it, but was it this year or last year that Mr. Burton was killed? I know you said it was post-Katrina, so I know it was...
It was post-Katrina. I'm not sure. I think it was, I can't remember exactly, but I
Okay.
know it was post-Katrina.
Okay, sometime after August 2005 and
Oh, yes.
before...
Oh, yes.
And before this. So could it have been in 2006?
It was either between 206 and this year.
Okay, so it was in
It was-
2006 and this year, okay.
How did you learn about that incident, ma'am?
Well, there was lots of talk about it in the community because he actually was one of the volunteers at Common Ground Relief at the Blue House in the Lower Ninth Ward.
So you learned about it by word of mouth?
Initially, and then it was covered on the news. Okay. Can I just...
I don't think we have any other questions.
No, I'm not finished.
Oh, I'm sorry.
Okay. You talked about not having enough inpatient beds. Is there sufficient outpatient care for mental health patients?
I would say no.
Okay. And is it worse post-Katrina than?
It's worse post-Katrina, and the access issue is really big because folks are not actively going out and seeking the help that they need. And what the Lower Ninth Ward Health Clinic would ideally like to do is, while we have people coming in for a physical exam, to keep them there and, do some type of mental health assistance, whereby we would have either a social worker or a psychologist. But at this time, we have some monetary constraints. But ideally, we would not let that person go. We would keep them there and just shift them to a different area.
One of the things you said was that access for inpatient, and I believe for people on the east side, was very poor. They had to go 70 miles, was it?
What happened was, before the charity hospital system started coming back, This was like in 2005. Women had to travel 70 miles to get prenatal care.
Prenatal care, okay.
And what happens is, as time progressed, the different specialties started to come back. There is now a prenatal clinic, but at that time they didn't.
Okay, so when did that prenatal clinic come into existence?
I believe it was this year.
Okay.
Mr. Garcia?
What's morbidity?
You're talking about illness.
Okay. Okay.
I just wanted, I didn't hear the statistic for depression, PTSD, and anxiety.
I can't give you overall. I can tell you what we're seeing at our clinic.
Yes, please.
And it's about 95% of the people are exhibiting mild to severe cases of depression.
Okay, thank you.
Muchas gracias por su testimonio.
Thank you for your testimony.
Nos va a ayudar a nosotros también a tomar una decisión bien objetiva.
It will enable us to render a very objective
Tengo varias preguntas.
judgment. I have various questions.
La primera es, ¿aumentaron los servicios de medicina privada después de Katrina?
Did the private healthcare services increase in number after Katrina?
Y también se aumentó los costos de la medicina privada después de Katrina.
And did the cost of privately secured medicine go up for folks after Katrina?
La otra,
Second,
las enfermedades costosas como cáncer. ¿Qué pasa cuando en la clínica donde usted trabaja y no pueden responder porque no hay dotación de equipo para esas enfermedades costosas?
what about those illnesses that are extremely costly, cancer or others? What happens to people who may need that care? Is it available?
Otra pregunta.
Okay. To answer the first question, as far as private hospitals that were located basically outside of New Orleans, they were starting to absorb many of the residents. They were not used to this population because pre-Katrina, they only had a very small number of uninsured patients. Post-Katrina, it went up dramatically. They were very concerned because it affected their bottom line. They felt that they would probably go out of business if this continued. So we've actually had some hospitals to sue for reimbursement of the uninsured patient. As far as medications, I can tell you that with folks losing their jobs, there has been difficulty in them actually being able to obtain their medicines. What we've done is we've gotten a copy of 100 medications that Walmart's and Target have that are $4 generics. And what we had done was we would fax their orders to their prescriptions to the Walmarts across the river because there was no Walmart pharmacy open in New Orleans for a very long time. It wasn't until this year that a Walmart pharmacy, so we would have to go outside of New Orleans to pick up prescriptions for our patients that were $4 and bring them to the clinic. We also enlisted them or enrolled them in some of these programs where you can get free or decreased amount that you have to pay for your medications through the pharmaceutical companies. That was one way that we assisted them to get their medications. The medications are expensive, especially the ones for cholesterol. and that type of thing, and the medications for depression.
Okay.
Did you have another question?
Sí, no, sí, continúo. Cuando ocurrió la tragedia,
When the tragedy occurred,
países como Cuba y Venezuela
countries like Cuba and Venezuela
ofertaron ayuda
offered to provide
sin
help
condición
unconditionally
en medicina,
in medicine,
en médicos,
doctors,
en psicólogos
psychologists,
para tratamiento de estrés postraumático.
to deal with this post-traumatic stress.
¿Sabe usted las causas por las cuales se rechazó esa ayuda?
Do you know the reasons why that help was rejected?
I can't tell you why it was rejected. It was something that was done on the governmental level. What has come out through some of the newspapers that I've read is that our government said that we did not need the help, that they were handling the situation adequately. We have gotten information just by word of mouth. We have friends who had family in Italy, and they said the Italian government offered to send cruise ships, and they sent medication and different relief supplies. And from what the cousin said in Italy was that the supplies rotted on the docks. So we don't know what happened, but we were not asked, did we want the help? Our government spoke for us.
Okay. Gracias. La última pregunta. El presidente de los Estados Unidos, George Bush,
Finally, the last question, the U.S. President George Bush
estuvo una vez más aquí en New Orleans
was once again here in New Orleans
días atrás.
a few days ago.
Quiero saber qué ofreció el señor Bush para resolver el problema de la salud
What did George Bush
aquí en New Orleans.
offer to help resolve the health care situation here in New Orleans?
Well, I can tell you this, the federal government, it's really difficult to know what's going on, but these are just some things that we have observed. The federal government initially sent $300 million down to shore up some of the infrastructure for health care here in some of the most devastated areas in the state. New Orleans was hit really bad. Also St. Bernard, Plaquemines parishes. However, when our state, the state of Louisiana, divided this money, only 13% was sent to New Orleans. So this next time there was $100 million that was appropriated for a 4-parish area. So I guess Secretary Leavitt decided he wanted to specifically state where he wanted that money to go. So this time the money was sent to Orleans, St. Bernard, Plaquemines, and Jefferson parishes. So I do not know how that money will be divided. However, there just seems to be forces at work which does not want New Orleans to get back on its feet. That is my assessment.
Gracias.
Okay. I have one follow-up question to Dr. Garcia's question on the aid offered by Cuba and Venezuela. Based on your assessment of the health care needs for the population you were servicing, could that aid from Cuba and Venezuela have been used?
It certainly could have. We have a population here that has been underserved for such a long time, and as I said, when Katrina happened, it just exacerbated everything. So it was a time when the more resources that you add to the problem, add to this whole thing, it would help to resolve the problems that we were having. But I did want to say this, that Common Ground Relief was on the ground giving aid to those who needed it right after Katrina, when there was no local, state, or federal entities here in the city. And they started the Common Ground Clinic across the river. They were the catalyst and helped us tremendously in the lower Ninth Ward to get our clinic together. We are now independent and autonomous, community-run and community-driven. But I must commend and I must thank Common Ground Relief for all of their work that they have done to help us to get back on our feet. Because had it not been for them, I do not think that we would be at this point right now, trying to provide some type of medical care to the people in a community who need it so badly.
I just have one question for clarification for my notes. When you say across the lake or across the river, what do you mean? Okay. Many of us are not from here.
I'm sorry. There are, New Orleans has a part. There's the Mississippi River, and that's, there, across the river, as I said, the Mississippi River, there is a part of New Orleans. But there are also...
Well, now, what is that part called?
It's called Algiers.
Okay, so when you say across the river, you mean Algiers.
Right. I'm saying Algiers. But there's also Jefferson Parish, which has many of the hospitals that were able to continue service post-Katrina. And there were other hospitals on the East Bank, which is in this area of New Orleans, that were able to continue in Jefferson Parish, that had continuous service, basically, after Katrina. Across the lake is considered in St. Tammany Parish.
It's what parish?
St. Tammany.
And that's in New Orleans still?
No, that's a whole different parish. Orleans is
New Orleans.
Is New Orleans.
Okay.
Yes.
A senhora tem uma boa experiência administrativa, né? O que é muito bom para possíveis sugestões para esse tribunal. Mas quero lembrar rapidamente que em todos os países em que há uma sociedade dominada por...
Só um minutinho. Pode repetir, por favor?
A senhora parece ter uma boa experiência administrativa.
You seem like you have a good administrative experience.
O que nos pode ajudar em sugestões para
That could help
esse
us
tribunal,
with suggestions for this tribunal,
que é internacional.
this international tribunal.
A grande verdade é que em todos os países
In all of the countries
em que há uma dominação de brancos, em especial capitalista,
in all the countries that have a white domination and a white capitalist domination,
os negros são atendidos nos hospitais
black people are receive
diferentemente e em termos de categoria de cidadania em relação aos brancos.
black people receive different treatment from whites in hospitals.
E logicamente não é diferente neste país que é o coração do capitalismo.
And logically it's not different in this country that is the heart of capitalism.
O senhor Malik falou hoje de manhã
As Malik said today in the morning,
da ação das forças militares aqui na cidade, nessa cidade aqui, né?
the actions of the military forces here in the city.
E a grande verdade é que essa presença militar
And in reality, this military presence
do governo americano
from the American government
é desta forma, dessa violência em todos os países do mundo.
it's this violent form in all of the countries of the world. Is the same violent form in all the countries in the world.
Às vezes de forma direta
At times in direct forms,
às vezes de forma indireta,
And at times in indirect forms.
financiando ações
Financing
policiais e
actions.
militares nos países, né?
Financing police
Ou
and
de
military
mercenários.
actions in countries or through mercenaries.
É importante que a sociedade americana pense sobre isso e assuma uma posição.
It's important that the American soldier thinks about this and takes a position on it.
Agora, eu gostaria que a senhora
But I would like to
apresentasse
say
algum
that-
tipo de sugestão
But I would like to make a suggestion
para que nós pudéssemos levar ao nosso país em termos de ajuda humanitária para a população aqui de Nova Orleans.
that we would be able to bring some sort of help
Muito obrigado.
from our country to the people of New Orleans. Thank you very much.
Thank you.
Okay. Thanks.
You want to... You want me to call her back? Oh, you want her back? It's okay. What do you want to do? Do you want her to... She's right there. Yeah, sure. Propose it. Okay.
Okay. Yeah. Okay. Do you affirm that you will tell the truth and nothing but the truth?
I affirm.
Can you state your name, please?
Adana Johnson, ADANNA JOHNSON,
And where do you live?
Houston, Texas.
Can you state your profession?
I have a doctorate in counseling psychology, and I'm a visiting professor at the University of Houston.
You have been working with the displaced population in Houston. Can you please tell us about that work?
Yes, I joined a community organization that is a coalition of mental health professionals who come from social work, psychology, and psychiatry to address some of the needs that were not being met initially once the 250,000 individuals came from Louisiana originally to Houston, Texas, and to address the continuing needs of the 150,000 that remain.
And you did a lot of work with children?
I primarily worked in groups with children and adolescents, but did experience groups with adults addressing the issues around their new home in Houston.
Can you just explain to us some of the issues that emerged, depression, and some of the things you mentioned?
Well, one thing in terms of context about Houston is that there about 36.8 million people in poverty in the state of Texas, and 3.6 million of them reside in Houston, Texas. So there was a lot of existing poverty and subsequent issues that come along with poverty, such as homelessness, drug abuse, violence, and these things were existing issues. So what we were dealing with is a system that was already drained in terms of resources for mental health treatment. And the folks who came in, the 150,000 that continue to live in Houston, Texas, who were disaffected by the Gulf storms, many of their needs were being unmet by traditional mental health care. And the coalition that I worked with essentially tried to do psychoeducational groups and provided resources, provided support to gain resources for mental health treatment, and to also address some of the issues that were less severe in group settings. Specifically, I worked with children and adolescents on adapting to their new environment, addressing issues of discomfort, isolation, and segregation within the school systems. And by that, I mean feeling alienated because of the differences in culture, in New Orleans culture, in comparison to the culture of Houston. Many of the schools weren't welcoming of the children into their already crowded schools, and the children were being, I've had adolescents in my groups tell me that they were unwanted by both their peers and by teachers, as well as other school staff, principals, assistant principals.
You've stated that the children didn't get the counseling that they needed.
Correct. Because the schools, and especially, this is for especially early on, and this does continue to be an issue presently, but because the issue was to get children acclimated into the school system as quickly as possible with regard to being in their proper grade, ensuring that they had textbooks and things of that nature, their mental health needs were going unmet. School counselors whose goals are to typically address both mental health issues and some scheduling issues were over-focused on scheduling issues and did not have the opportunity or the means to address the mental health concerns. So typically one of the areas with children and adolescents that you begin to address mental health problems is in the school system. The school counselors and the school psychologists focus on some of these issues that maybe come about through the manifestation of behavior in the classroom. Well, this was, the behaviors were there, but they weren't necessarily able to be addressed appropriately because school counselor staffs were working on scheduling issues and just the overall business of making sure children were in their proper places.
And so you found that people from this displaced population were depressed?
Yes. I think that children were isolating themselves because of the rejection that they were experiencing within the classroom from their peers and from their teachers.
And also, did people have difficulty recovering from the trauma of Katrina?
There continues to be difficulty recovering from trauma. One issue is the desire to return back home, and families being faced with the notion that they cannot afford to do so, so there continues to be re-traumatization. Many of the children were holding out hope for the first year that they were in Houston that they would have the ability to return home, and are now being faced with the fact that their families cannot financially afford to return to New Orleans and are having to stay in Houston. So there is an additional trauma, loss of hope, hopelessness.
Okay, thank you. Do the judges have any questions?
You have a question? You have any question? Ms. Ayatoro.
Just one question. You said the counseling staff were the counseling staff was consumed by scheduling issues. What do you mean by scheduling issues?
Well, typically school counselors, they not only address mental health issues and ensure that students are getting all the services they need, whether that be accommodations in terms of the classroom, psychological testing, coordinating those things with the school psychologist. They oftentimes, particularly at the high school level, are involved in scheduling, so ensuring that students have the credits that they need to continue on from grade to grade. The other piece of that I think that is important to add is that a piece of culture. So many of the individuals and their families who moved to Houston had experienced racism and discrimination in their early experiences within the George R. Brown Convention Center and the Astrodome in Houston, Texas. And they were seeking experiences with black mental health professionals, those who were black, the displaced persons who were black, were seeking that out. And nationally, we know that there are only 4% of 2% psychologists and 2% psychologists are black mental health professionals in the United States. So there's equally a dearth of those people within Houston, Texas. And so another responsibility that the coalition had was to try to meet these needs of individuals who were seeking mental health care from black mental health professionals, and that did not really exist in mass. So that was another piece of us working more in group form that cuts down on cost for the individuals, and for the majority of the workshops that we held, they were all free of charge. So we're trying to meet a need.
Ms. Johnson, Dr. Johnson, was there federal dollars were there federal dollars available to your group or to the Houston community to try to assist you in servicing this additional large needy population coming from Louisiana?
Yes, there were initially funds that were given to the coalition that I worked with to provide services within the first year or so after Katrina. However, those funds were not replenished after the first year, and we have been forced to continue by our own means. And that means that many of the professionals that give up their time, the workshops are no shorter than 4 hours in length, and we provide meals, we provide resources of depression screenings, informational pamphlets, and we provide connections to psychologists and psychiatrists within the Houston community. We were doing all of this work for free after the funding was pulled after the first year anniversary of Katrina.
I believe you told us earlier, but please remind me, approximately how many people were unable to return and remain in Houston?
Approximately 150,000 people remain in Houston who were disaffected by Katrina.
Okay. Thank you. Any other questions?
Yes, yes. This is a difficult question. I don't know, Dr. Johnson, if you're the right person to ask. Children in mourning, having lost parents or parts of their family who have disappeared, who cannot be found, whose bodies cannot be found. I know their statistics for this are difficult. Mourning for this is difficult. Have you had any experience of this?
I've had experience with one individual in a group whose parents had died. However, there was accountability for their remains, their physical remains. I've not had any experience directly clinically with children whose parents were or caregivers were unidentified and still have not been identified.
Yes.
Señorita Thompson, del desplazamiento interno, hay que utilizar mucho esa figura, desplazamiento interno.
Ms. Thompson, of the internally displaced,
Desplazamiento interno forzado.
of the forced internal displacement.
¿Tiene usted alguna estadística de suicidio dentro de los desplazados internos en Houston?
Do you have any statistics in terms of the people who have committed suicide among the internally displaced population that lives in Houston?
No, I don't have any suicide statistics.
Gracias.
Any other questions from the jurors? Thank you, Dr. Johnson.
She'd like to add one
Ma'am.
more comment.
Thank you. I wanted to add that this past February, the mayor of Houston, Bill White, held a training in regards to trauma, specifically for mental health professionals. And I bring this up to underscore the lack of representation of African Americans in the mental health care system within Houston, Texas, that to address these issues of those disaffected by the Gulf storms. Amongst the 100 professionals that were present who were called to be a part of this training, there were email blasts that were sent out throughout the city through various organizations, for-profits, not-for-profits, hospitals, private industry, to call forth mental health professionals to this training. There were only 3 African American psychologists present. And during this training, there was no massive discussion, no major discussion about race and culture, nor was there discussion about how to address the existing needs of those disaffected by the Gulf storms who remain in Houston, Texas. So I think that underscores the oversight, the extreme oversight that continues to be the case not only in Louisiana but also in Texas, where many of the disaffected individuals currently reside and will likely be for some time to come.
Thank you very much.
Thank you.
Do you affirm that you tell the truth and nothing but the truth?
I do.
Can you please state your name?
My name is K, which stands for Kenneth. Brad, B-R-A-D, and my last name is Ott, O-T-T.
And can you tell us what your connection is to the healthcare system in New Orleans?
My connection is one as a patient and as a healthcare advocate. I had a stroke almost 4 years ago from sitting too long on a trip. So for all of you who've traveled here, please do get up and walk around. It's a DVT, deep vein thrombosis. And I had that afterwards when I got to the hospital in New Orleans. And I made it within the realm of the window of time for a stroke. And Charity Hospital in New Orleans saved my life. When my care was there, of course, then they discovered I had a heart defect, which I still have, and I'm still waiting for care to have corrected. I had been a community activist for many years before my time of being involved with health advocacy and public health support, and I just sort of vowed that, you know, at the time I went into Charity Hospital, there were massive budget cuts. $66 million were cut from the Charity Hospital budget, and I should note that Charity Hospital is both a single institution in New Orleans. The formal name of the campus that's closed is the Reverend Avery C. Alexander Charity Hospital. That was named after a human rights activist, Reverend Avery Alexander, and it was named in his honor in 1999. But when we also speak of charity hospitals, we also speak of a network of 11 hospitals throughout the state of Louisiana. It's unique in the U.S. In that, at least on the surface, puts forth a comprehensiveness of health care through state care. But as previous testimony has indicated, it had become basically a two-tier system of where the uninsured, and myself, I was uninsured at the time. I was working for a health concern at the time when I had my stroke, but they didn't provide insurance for their workers. Anyway, so basically charity hospitals ended up with all the care of the uninsured. But it should also be noted that in New Orleans, Charity Hospital, Big Charity as we affectionately call it, was also the main trauma hospital for private as well as public hospitals. It had the region's only level 1 trauma unit. Level 1 indicates that it provided multi-specialty care 24 hours a day, 365 days a year. In addition, as has been mentioned, it was the only hospital in South Louisiana with a crisis intervention unit, a psychiatric unit that basically allowed authorities, if people were picked up on the street, as has been mentioned with a couple cases, they can bring them to a central place, have them received by hospital police, and then the police could be on their way. All this, of course, changed when Katrina came and the hospital was closed. And I guess I'll just say for that is that, and I wish to note for the record, that there was an attempt to reopen the hospital. Its medical staff, who had endured 5 to 7 days waiting to be rescued from the hospital, and actually the second anniversary of that rescue is this Monday. And we actually intend to be out there at noon to honor those medical staff and the patients who had to endure that length of time, the week being forgotten at the hospital, quite literally, because the Tulane Medical Center across the street was evacuated, and they had a heliport, and they were people were getting helicoptered out of that hospital, but at Charity they were forgotten for a few days longer. And well, the medical staff, along with the U.S. military, the Alabama National Guard, the Oklahoma National Guard, the 82nd Airborne, they went in and they cleared all 21 floors of that hospital of perishable refuse. They drained the basement of floodwaters. They restored the sanitation and electrical systems. They provided chilled air to the whole complex. And they had its first 3 floors, including its emergency department, its scores of outpatient clinics. Before Katrina, there were 160 outpatient clinics that were operated out of Charity Hospital. And then the 3rd floor is psychiatric ward, crisis intervention unit. And they cleaned all that and had it ready to reopen on about September 19th, 2005. And in my sort of formal statement to the tribunal, I've resourced all those statements. And I'll just say, just for the record too, and I guess for reference, part of my ability to have been able to find this out is after my care, I became active in kind of the political realm and advising. And I was appointed to a state board, which I still sit on. It's the Region 1 Healthcare Consortium, representing Jefferson, Orleans, St. Bernard, and Plaquemines parishes. And I specifically was appointed to represent the uninsured. Of course, ironically, the same governor who's this board advised, and she won her office in a very narrow election based on the pledge of not closing charity hospitals. And her opponent is our likely governor to elect, Bobby Jindal, who is Secretary of Health of the Department of Health and Hospitals, was proceeding to close charity hospitals before the storm. But we have no choice here. We're really at the mercy of our government. Basically, the charity hospital system is run by the Louisiana State University. The southern hospitals, the 8 hospitals, were run by the Healthcare Services Division of the LSU Health Sciences Center. There are 3 hospitals in northern Louisiana which are run by LSU Shreveport. And essentially, they made an administrative decision to close the hospital permanently because they had already in their designing plans, and as I noted in my stated testimony, that they had planned to close the hospital and consolidate it with a much smaller facility known as University Hospital, in order to benefit exclusively their graduate medicational functions. You know, it may not be so foreign to have university hospitals take care of the poor and uninsured. It happens in other states. But here in Louisiana, Charity Hospital goes back over 280 years. Aside from Bellevue Hospital in New York, it was America's oldest hospital. And basically, the hospital relationship, which I fear and I wonder about as a patient, is we shift from being just patients, which is hard enough, as the testimony previously stated, can be insensitive and uncaring. But if you are in a teaching situation, you automatically, patients become subjects. And having already been a patient through the LSU Dental School, which, you know, I want it to reopen, but I also know that when I protested having a filling filled with mercury filling, they said, well, hey, you agreed to a contract, so you need to go by the contract or be out of our program. And so, you know.
Brad, I'm sorry, I just want to interject.
Please do.
I'd like you to talk a little bit about the way that money's been spent and money that was received and rejected.
Thank you, yes. You know, as has been brought forth in testimony and in the popular press, the Federal Emergency Management Agency, much aligned, as we would say in America, or in New Orleans, it's a four-letter word. But they did have a decidedly marked change right when the storm happened, which was they were actually, for folks who had individuals who had bank accounts, for example, that their banks also had branches outside New Orleans. That was one of the rude awakenings. The individuals realized that they couldn't get relief funds sent to their bank account because all their branches were in New Orleans. But FEMA was giving out grants, and FEMA gave out a grant of $352 million for health care in the weeks after the storm. This grant was given to the Department of Health and Hospitals. I note in my information, I think it was a report on September 27th, 2005, where basically they returned all but $8 million because they could not use the money quick enough, and they feared that procedurally, if they held on to the money, it would compromise, they would have to pay it all back, and they were worried about that, at least, and that was the report. I subsequently, on this and other matters, did public records requests to find out the story. And I found one document which I reference, which the Office of Emergency Preparedness under the Governor's Office, they have a military section. And in conversations and interviews that I had with both military and medical personnel who helped clean out the hospital afterwards, that they had said that they had appealed to the government, to the federal government, for resource in order to reopen the hospital and restart units and operating costs and to retain staff. Well, I found one email which they had said that